This is Graham, and this is the second of two videos about CBT, cognitive behavioural therapy. Many people could be attributed with devising CBT, but Aaron Beck is probably the most credible. As a trainee analyst, Beck had been using some techniques developed by Alfred Adler a few years earlier, and was already getting some flack from the psychoanalytic community because he was able to achieve results faster than established therapists. In-house politics were unfolding at the University of Pennsylvania over the appointment of a new head of department, and various people tried to embroil Beck. He wanted nothing of it, and so he took an extended sabbatical from the university between 1960 and 1966 to concentrate on his private practice. In the spirit of the analytic movement, he made very detailed case studies of the clients seeing him and their progress. When reviewing those with depression, the one illness that the psychoanalytic community had difficulty working with, he observed that many of his patients didn't necessarily exhibit suppressed emotional responses, as in Freudian models of the unconscious, but instead had consistent basic mistakes in their thinking. Focusing on depression, Beck found 6 common cognitive distortions, the 6 that we explored in the first of these videos. With the explosion of research into cognitive biases, with over 300 formally identified, it's a bit alarming to think that he might never have developed CBT if he'd not been working with such a small set. Had he had to deal with the 300, he would have probably been overwhelmed by them and not recognised a pattern. The 6 that he identified were selective abstraction, where someone makes a decision on the basis of just a little bit of evidence rather than taking the bigger picture into account. Minimization, where somebody favours a negative possibility by playing down the importance of positive ones. Personalization, where we either take personal responsibility for something that wasn't our fault, or blame someone else when it wasn't theirs either. Arbitrary inference is where we draw a conclusion when there is little or no evidence. Magnification is where we blow things out of proportion. And overgeneralization is where we make sweeping conclusions when there's little or no evidence to support them. There are a number of different schemas for the application of CBT, but most cover these 9 steps. Identifying the behaviour that is problematic and estimating how significant it is. Determining what the emotions are that are associated with it. Identifying and documenting the underlying thoughts. Taking these and reconceptualizing them, helping the client rewrite them in a more constructive manner. Helping them to learn this new way of seeing them. Revisiting the process a few times. And then following up with an assessment of the emotions, their severity, and the behaviours that were previously experienced. Despite the initial focus on depression, in the United States, all psychotherapists are now required to have completed a training in CBT. In the UK, NICE recommend it as the first treatment for most psychosocial disorders, from anxiety and depression to phobias, addictions, eating disorders, stress, and even schizophrenia. It's been widely empirically tested, and it shows a significant improvement in symptoms in most cases. It can also be used alongside medication. It's been shown to prevent the onset of certain conditions, and in particular PTSD, and it's therefore used these days for critical incident debriefing. However, it is not a panacea. Other conditions, and many of these conditions, still require longer-term talking therapies associated with them.